Senator Biden, this issue is somewhat uniquely applicable to Iowa. It has to do with Medicare reimbursement. It's having a huge impact on our healthcare systems out here. Iowa's Medicare reimbursement rate is among the lowest in the country. That has a disproportionate impact because of the high percentage of elderly in Iowa. How would you correct Iowa's low Medicare reimbursement rate?
By containing costs, not cutting providers, allow us to negotiate with the drug companies for lower prices, modernize the record keeping and deal with preventative disease, deal with prevention, deal with issues like obesity and other issues that will cut down costs considerably. And I would stop paying insurers, overpaying insurers. We overpay them, the insurance companies overpay them $10 billion a year more than reimburse folks right here in the hospitals and deal with care. And I set up a competitiveness effectiveness panel which would create equitable reimbursement so you don't end up at a disadvantage. You are at a disadvantage, and it's not fair. The primary care physician, for example, who prevents a heart condition by putting a person on a regime relating to diet and exercise should be reimbursed as much as the cardiologist who goes out and deals with saving the life of the person who has lived the life that puts them in a position to make them much more vulnerable. We have to change the way we reimburse, and we have to be able to attract in places like Iowa and the southern part of my state doctors and physicians who are willing to come here and provide the best health care. And I would reimburse them through paying off their medical school loans in order to get them into communities like this community and like my community.
Senator Dodd.
Well, this is a great subject and important one here. And this state does have a very serious problem on Medicare reimbursements. And you're right to point out that one of the lowest, I think, in the country, and obviously needs to be addressed. If we just negotiated, as we do with veterans, on the purchase of prescription drugs, over the last 6 years, we would have saved $330 billion in the Medicare program. That alone is all you need to do to provide the levels of reimbursement that Iowa needs and that other places need, to see to it that physicians and healthcare providers are getting what they need in order to service that community. Let me mention two other things related to this as well, the limited time we have. One is to deal with the whole issue of chronic illness. 73% of Medicare dollars are spent on chronic illnesses. People turn 65. I would advocate providing for a physical for everyone at the age of 55 to early determine whether or not these chronic illnesses exist, so we can deal with them early on and minimize the cost when you reach retirement age at 65. And thirdly, prevention. We don't reward enough in the medical profession for keeping you out of a hospital and out of the surgeon's office. We ought to be recognizing the people who keep us healthy, rewarding businesses that have healthy work environments, rewarding people on lifestyle issues here. So we incentivize people to lead healthier and better lives, reducing the problems of chronic illness that are occurring. So prevention plays a very important role, one we need to emphasize. On early physical, determine the chronic illness problem here. And then we're having the ability, of course, as I said earlier, to purchase these prescription drugs, which are so life-saving and so important. But it ought to be done on negotiating it to do with the VA. That alone will provide the resources necessary to deal with reimbursement.
Further comments, Senator Biden?
5% of those who seek health care are responsible for 48% of all the health care costs. The older you get, the greater the cost. The idea that we are not going to care for an elderly person here in this state versus the city of New York with the same quality of care is just not right. We can remedy that, and my time is up.
Senator Dodd.
Well, just briefly, one other area I wanted to address is because we're in a state where there's a significant rural population, and opportunities too often don't come to rural America. And we need to make sure that in healthcare issues we're going to do that. I don't want to see a handful of companies control broadband access and the ability to provide healthcare information to constituencies in rural communities such as in Iowa. And so as president, I would oppose any effort to have a handful of people control the broadband, so the health information that's so critical to people ought to be able to be provided to them in communities and counties that don't have needed access to the kind of health care providers that information might provide them.